students, welcome back. Now we are going to see the intercostal arteries in detail. Each intercostal space contains one posterior intercostal artery and two anterior intercostal arteries. Okay. And the greater part of the space here, if you can see, the greater part of the space is supplied by the posterior intercostal arteries. Okay. Now coming to the posterior intercostal arteries, there are 11 in number on each side. One in each space. Totally how many? 11 intercostal spaces, isn't it? Here this is the vertebrae. So this vertebrae, and it is having 11 intercostal spaces, isn't it? So each intercostal spaces will have one posterior intercostal artery. Okay. So, and the first and second intercostal arteries, posterior intercostal arteries, are arising from the superior intercostal artery, which is a branch of costocervical trunk, that we have already seen. From 3rd to 11th arteries, that is the next 9 pairs arising from the descending thoracic aorta. From descending thoracic aorta gives 11 pairs of posterior internal thoracic arteries. So the first two are coming from costocervical trunk. So it is giving one branch called superior intercostal artery. That superior intercostal artery will give two posterior intercostal arteries that pass in first and second intercostal spaces on both the sides, and the remaining 9 pairs are coming from the thoracic aorta, that is the descending aorta. Okay, so here in this pic you can see this one is the thoracic aorta, which is present. This is left side and this is right side. So it is placed mostly on the left side. So the right posterior intercostal artery is longer than the left posterior intercostal artery. Okay, so now we will see the codes and relations of this thing. So in front of the vertebrae, the right posterior intercostal arteries are longer than the left and pass behind the esophagus. So just think about the inlet, isn't it? So the structures which are passing through the inlet. So all those structures which are present on the anterior aspect are related with this artery on the anterior side. Okay, so now the right posterior intercostal arteries are longer than the left and pass behind the esophagus, thoracic duct, and azygos vein. So here you can see the azygos vein, and also the sympathetic chain, azygos vein on the right side, left side hemiazygos vein, and sympathetic chains on more posteriorly, sympathetic chains. Okay, the left posterior intercostal arteries pass behind the hemiazygos vein and the sympathetic chain. So these are the relations in front of the vertebrae. So the right posterior intercostal artery are longer than the left, and the right one passes behind the esophagus, the thoracic duct, and the azygos vein and the sympathetic chain. So what are the relations for the right posterior intercostal artery? One is the esophagus, so esophagus, thoracic duct, and azygos vein, and then the sympathetic chain. On the left side, the left posterior intercostal arteries pass behind the hemizygous vein and the sympathetic chain. Okay, this is the chords in front of the vertebrae, and then in the intercostal space, so the artery is accompanied by the vein and nerve, isn't it? Vein and nerve. So the artery is present in between the vein and nerve from above downwards. So the artery is accompanied by the intercostal vein and intercostal nerve. So the relationship is like this. So above vein and below nerve. So this neurovascular bundle runs forward in the costal groove. So it runs forward in the costal groove first between the pleura. So first between the pleura and the internal intercostal membrane. So here you'll have the internal intercostal membrane and the pleura. So in between them, first this artery will move, and then in between the internal intercostal and intercostalis intimae muscle, same as the nerve, it is accompanying with the nerve, isn't it? So it moves like that. So and the termination, so the main trunk, here you can see this is the main trunk of posterior intercostal artery. It is getting terminated with the upper branch of the anterior intercostal arteries. So here you can see anteriorly, this one is the internal thoracic arteries. Each internal thoracic artery gives a pair of arteries in each intercostal space, in that the main trunk of the right posterior intercostal artery will anastomose with the upper branch of the internal thoracic artery, which supplies the intercostal space. Okay, so this is the chords and relations of the intercostal arteries. So now coming to the branches here. So a dorsal branch, here you can see this is the dorsal branch. A dorsal branch supplies the muscles of the skin of the back and gives off a spinal branch to the spinal cord and the vertebrae. So it supplies to the skin and back muscles, and it also gives a branch to spinal cord and the vertebrae. And after, at the angle of the rib, a collateral branch arises near the angle of the rib. It descends, this collateral branch descends to the upper border of the lower rib. This collateral branch descends to the upper border of the lower rib and ends with anastomosing with the lower anterior intercostal artery and the lower intercostal artery. And then it also gives some muscular branches which are given off to the intercostal muscles and also the pectoral muscles and the serratus anterior. It also gives some muscular branches, and it also gives a lateral cutaneous branch. Also it is giving a lateral branch which is accompanied with the lateral cutaneous branch. So this one also comes out along with this nerve, and it is giving some and it is divided into anterior and as well as the posterior branches, the lateral one. Okay, and also another branches, memory branches, arise from the second mammary branches arise from the second, third and fourth arteries and supply the mammary gland. Okay, the right bronchial artery arises from the third posterior intercostal artery. So these are the branches of intercostal arteries. So what are the branches? One is a dorsal branch which supplies the muscles and skin of the back, and it is also giving a branch to the spinal cord and the vertebrae, and it is at the angle of the rib. It gives a collateral branch which descends to the upper border of the lower rib and ends anastomosing with the lower anterior intercostal artery of the space. And then it also gives a lateral branch which is accompanied with the lateral cutaneous branch, and it is also divides in the same manner as the lateral cutaneous nerve. And it also gives some mammary branches arising from second, third and fourth arteries and supply the mammary gland. And the right bronchial artery arises from the right posterior intercostal artery, that is the third posterior intercostal artery. This is about the branches of posterior intercostal arteries. Now we will see the anterior intercostal arteries. So here you can see this is the internal thoracic artery. So now we are seeing it in only one intercostal space. So this one. So in each intercostal space, this is the type of distribution. So the internal thoracic artery gives two anterior intercostal arteries. Two intercostal arteries. One is the upper anterior intercostal, another one is the lower intercostal artery. So the upper anterior intercostal arteries run below the lower border of the upper rib, whereas the lower anterior intercostal artery runs near the upper border of the lower rib. Okay, so these are two anterior intercostal arteries in each space. In the upper six spaces, the branches are coming from the internal thoracic artery. Okay, and the remaining from 7th to 9th, it is supplied by a branch of internal thoracic artery called musculophrenic artery. The 10th and 11th spaces do not have anterior intercostal arteries. Okay, up to 9th intercostal space only we are having anterior intercostal arteries. For the 10th and 11th spaces, it doesn't have any anterior intercostal arteries. The anterior intercostal arteries end at the costochondral junction by anastomosing with the posterior intercostal arteries. The lower arteries end up by anastomosing with the collateral branches of the posterior intercostal artery. So that means this collateral branch of the posterior intercostal artery will end up with the lower anterior intercostal artery. This is the anastomosis forming between the anterior intercostal arteries and the posterior intercostal arteries. Okay, so this is about intercostal arteries. Okay, so here you can see the descending thoracic aorta, which is giving left and right posterior intercostal arteries. This is the internal thoracic artery, which gives a pair of anterior intercostal arteries. Okay, so this is about the intercostal arteries. In the next video, you can see the schematic representation of the intercostal arteries. Okay, thank you.